In the realm of male sexual dysfunction, whether it be erectile dysfunction, Peyronie's disease, ejaculatory dysfunction, we are really at the cutting edge of all possible treatments available to men worldwide. We offer everything from medication combinations to non-surgical interventions to surgeries for penile implants or surgeries to address Peyronie's disease as well. And we really do take a comprehensive approach to those treatment options, really offering patients every available option that there may be to treat their disease.
When it comes to erectile dysfunction, I think a lot of men don't address their issues early on and only come to see us when things are really not going well. When it comes to treatment and diagnosis, so we need to make sure that hormone levels are within normal range, make sure the blood flow into the penis is normal. We use a penile Doppler to do that. When it comes to treatment options, we use oral medications, the first line of therapy, PDE5 inhibitors, but we also have vacuum devices, injections into the penis, and if needed, we can use a penile implant to achieve a good erection. When it comes to ejaculatory dysfunction, it kind of splits into three different fields. So there's premature ejaculation, delayed ejaculation, and absence of ejaculation. They all need to be treated differently.
Peyronie's disease is characterized by a curvature of the penis, and oftentimes men will have what's called a scar or plaque in their penis that causes the inability for the penis to expand fully in the erect state. And oftentimes men will have a curvature in the direction of their scar, their plaque, and that curvature can be mild or it can be more significant. It can interfere with their ability to be sexually active. It can cause pain.
I'm the director of the Center for Male Reproductive Medicine and Surgery. And that basically includes disorders of the reproductive tract and disorders of the penis, which you need in order to be fertile. And my particular practice is devoted basically to testicular disorders. If you look overall, about 15% of all couples who are trying to have children are unable to. By talking to a patient, doing a single semen analysis, and then doing an examination, and it's so much easier to do the examination in the male. And then finally, the only testing I'll start with is the semen analysis. 90% of the time, I can make a diagnosis and come up with a plan for treatment. And the treatments in men, it could be medications. Some men are missing the hormones that their brains make that stimulate the testicles to make sperm. And those can be treated by replacing those missing hormones. Some men have too much prolactin, and there's medication that can very easily treat that. Some men are blocked, their ducts are blocked, so the sperm can't get out, but they're making great sperm. If the blockage is from a hernia repair, which causes accidental blockage a significant number of times, or sometimes men are blocked because they've had infections. When one of my patients who I did surgery on to restore their fertility calls and tells me that they've had a baby, that makes my day every single time when I get one of those calls.
When talking about conditions like erectile dysfunction, Peyronie's disease, or ejaculatory dysfunction, you have to remember you're not alone. There are many men out there that have the same issues. Come see us. There are many treatment options, and we'll be happy to discuss them in clinic.